Okay, so thank you everyone for coming and being part of our forum today. We've had a very energetic annual general meeting and it's good to follow that up with a forum. I think this is a good approach because people can stay on later and have the benefit of the forum, which is a slightly different format to the AGM, but still we can relax a bit. Feel free to comment, as is the nature of these particular forum dialogues. They're very much open sessions. So we'll have Pamela, and we thank Pamela for being leading us into the topic. It will be essentially about attitudes and values in education, in a particular example. So that will be good, and it's great that we have an introduction to our services on YouTube, apparently, from our dear venerable Tam, Dr. Thich. Thanks for that, and we'd just like to, even though we already have this morning, just acknowledge the custodians, original custodians and elders of the land on which we meet. So that we can be here today and have this opportunity to be and through the United Nations Association of Australia and New South Wales as well. Now, what I would like to do, especially seeing as we are actually having, this is our first time that we've set this up to be on in a kind of a public forum beyond the usual way in which the forum proceeds, and that will be presumably will be happening on YouTube as well. To just contextualise a bit and just make mention of the reality that we have in fact, at long last, got in our journal, the Growing Community Living Together for this year. It's something which regularly happens, but it's been a little bit less regular this year because we found it a bit difficult to keep things going with all the different things happening. But we now do have one of those. So forum, I don't have enough here for forum participants today. I don't think we'll see to that in a minute. But we do have there's a few copies of it. And I'll pass this one around for people to see. Now it covers all the forum dialogue presentations for 2011, but not 2012 yet, which is normal anyway for our annual general meetings. It only covers things from March to March in this year. But it's more really just resources. We would have had one which didn't cover this year, but we've decided to hold that back and just so that we cover enough. We're putting forward the forum dialogue reports for 2011, but very soon we will be producing another one which will have the reports up to this year, and the plan for us really is to have that ready for the national annual general meeting, which will happen in August. So there will be one out for that, and a copy of that as well. But I'll pass that around for today. Now, to contextualise the forums, I think I mentioned at the AGM that we have been very much looking at the aspect of our personal responsibility in global and global terms, following our dear mentors, Dr. Stella Cornelius, who always emphasised that we need to respond personally as well as relating to the global aspects. So that's been very much a theme for the forums. Welcome, Brenda and David, for the forums in this last little while. Before we were beginning with the aspects of cultural and social diversity, and the focus was on those elements for the first few years of this particular forum style. So probably the first couple of years. So in that, we've been having a look at various presentations which bring forward our responsibility in personal terms to the collective. And what we've tended to do, we started off, for instance, with Maria looking at the Institute for Cultural Affairs, which is an organisation which encourages people to be involved in a global sense and provides resources and means for them to do that very well. And that's something you might ask Maria or myself about later. And then we had Dr. Joe DeBreed talking about autopoiesis, which is the way in which it's kind of like a process through which we can actually be more active in the world and in our environment by taking responsibility for our own development, our self-development. It provides ways in which that will happen. And then we had a couple of forums, one from Lloyd Fell and Noel Wilson, which was our previous one, where we actually considered ways in which we can learn to take responsibility and learn to be more responsible and responsive in the collective context. So Noel very much is about that, an advisor to the South Australian Education Department. And he talked about our intentions. We need to work out what our intentions were, which is the title of the book, The Best of Intentions, which I'll pass around if you have a look at. And relationships. How do our intentions relate to how we relate to each other? So change becomes important in that context, and I'm sure that Pamela will have a lot to say today about change and what it can mean for people who are not used to it. So we need to get used to the idea of change, but we also need to value what we have as well. So it's kind of a bit of juggling to do that in a way to find where we're living. And that needs to happen at the personal level as we relate to each other, but also as we relate to each other in other contexts, like the work context, our vocation, what is the purpose for our lives, and how are we working that out in the context of how we live and work. So he talks a lot about the importance of different values in regard to that, such as the value, how we value love is one aspect that he looks at, openness, awareness, how do we develop this? And he provides some means through which to do that. So that was really where Noel left us. Noel left us in talking about those things. But for me, this brings forward the aspect of quality in our lives. That's what it's pretty much all about. And I thought to begin Pamela's talk today, to perhaps set the scene a bit, I found this beautiful little, it was kind of a bit of a word on a particular author whose work I really like, or at least one particular work that he's written that I really like. I've got about three short paragraphs, which describe this work. It's Zen and the Art of Motorcycle Maintenance. If you know that work, I'm probably sure Franklin does. You might know it too. Robert Percy was the writer of that wonderful work. And just the three short parts about what he has to say in regard to quality and how it ends up permeating our lives. Much of the book, this is his book, Zen and the Art of Motorcycle Maintenance, much of the book focuses on a rather surprising topic, quality. We think of quality as a measure of a product or a person, and we feel the right to make judgments about it, because it is clear when something is of quality or not. The narrator, that's in the book, recounts taking his motorcycle to a garage and reluctantly handing it over to a crew of young men flying without using it. Instead of fixing the machine, they butchered it. And he learned a lesson. It is the attitude toward a thing, the attitude toward a technological problem, not simply rational knowledge of how the thing works, that makes all the difference. Merely going by the manual was clumsy, low-quality approach. Therefore, he did the work himself. And a little bit more. Quality cannot be defined in a rational way. It can only be noticed when it happens. Yet quality, so it's kind of intuitive in a way, an intuitive appreciation of it. Yet quality is everything. The difference between someone who cares and someone who does not. Between a machine that can enrich your life and one that explodes in a heap of useless material. Yet instruction manuals, the narrator observes, totally leave out the picture of the person who is putting something together. If you are angry or unmotivated, you will not succeed in turning the machine or finding the problem. But if you make the effort to put yourself into the head of the designer, you come to see that the machine is really just the physical expression of a set of ideas. Very interesting concept, especially in relation to this notion of technology which we'll be exploring later in the year in other forums. Paradoxically, and this is just one more short part, paradoxically it is only when you go beyond the classical idea that we can separate our mind from the world that objects begin to come alive. Quality is appreciated not as a thing, but as the force that drives the universe. The narrator notes, obviously some things are better than others, but what's the betterness? His epiphany comes when reading the ancient Tao Te Ching. He realises that what we call quality or betterness is the same as the Eastern concept of Tao, a universal power or essence that can never be identified as such, but the presence of which makes something. So I like that. And I think it fits very much with the idea of attitudes and values in education, working with those at a very basic level as you have and want to begin, but then developing, working out how they relate to people's lives, and from that being able to have more of an appreciation of the quality of what they are and what you're doing. So thank you today.
Thank you. Thanks for the invitation. Before I go into the actual topic, which is about values, attitudes and education in the context of community HIV/AIDS health program in the regional Vietnam, I would like to give you a bit of a snapshot of how I actually got there and what was it all about. So my name is Pamela, and I had this fantastic opportunity to work for the World Health Organization in Hanoi, Vietnam, last year in October, November, for 6 weeks. My background is public health, and that's how I got in there. What happened was that in October, November, when I was there, the treatment 2.0 is a treatment program that has been initiated by the WHO and UNAIDS. Was very new to Vietnam, and it was basically a new approach to the HIV/AIDS response that encourages innovation, efficiency, and most importantly, sustainability. The focus of the project was basically to scale up and make a universal access for antiretroviral treatment for people who are infected by the virus or who have AIDS. That treatment is called short ART treatment, which is a very important form of treatment and very effective treatment. It's through medication. So basically, how would they be able to implement the treatment 2.0 program was through 5 pillars. One was to optimize the drug regimes. Secondly, to provide point of care and more simplified diagnostic way of monitoring their progress. Thirdly, to reduce the cost. Obviously, antiretroviral treatment is initially very expensive, however, in the long term it's very cost effective. Fourthly, adapt service delivery, and lastly, mobilize communities. That's when the program that I was involved in organizing the workshop for peer educators was very much part of the last pillar, number 5, community mobilization. So you're probably asking yourself, why Vietnam? Well, the 64th World Health Assembly in May 2011 chose Vietnam to take the leadership in piloting the treatment 2.0 in 2 of its provinces, one in the northwest, bordering with Cambodia, and one in the south, very much in the south. And they were very different provinces. One in the north is very mountainous, very difficult to access. In the south is very much large population and surrounded by water, so they have easy access to ports and so on. Vietnam as such is one of the few countries in the world where the epidemic is very concentrated. So by that I mean a concentrated epidemic is an epidemic that relates to a particular form of population amongst the prevalent population in Vietnam. So there are 3 major populations that have been affected by the virus. It's people who inject drugs, secondly, female sex workers, and thirdly, men who have sex with men. So if you are part of that group, or one of those 3, you're most likely, or your chances to to get the virus significantly higher, as if you were not part of those three groups. The first case of HIV/AIDS in Vietnam was identified in 1990, and as I said, the spread remained concentrated among those populations. But out of those three, the injecting drug use is by far the most significant group that has been affected by that. So more than 70% of people with HIV/AIDS in Vietnam are part of the first group. As of September 2011, there were 193,350 people living with HIV/AIDS, and that's through a reporting case system. Out of the 193,000, 47,000 had HIV/AIDS and AIDS. So just because you're HIV positive doesn't mean you have to have AIDS. So you get infected by the virus, but you don't necessarily have to have AIDS. So 40,000 out of the 193,000 actually have AIDS. And 51,000 out of the 193,000 have complications that arise from HIV/AIDS. So that could be hepatitis C, for example. So we're looking at the very contrasting provinces, Kanto and Dien Bien. Just to let you know, you're going to get a handout where you will see a map of Vietnam, so it will be easy for you to locate those provinces. In Vietnam, the Vietnamese administration of HIV/AIDS and control is basically the main body that regulates that treatment 2.0. It has a big say in how and when WHO and UNAIDS can actually roll out that program. So it's short BAAC. The BAAC decided that treatment 2.0 is to be piloted in those two provinces, as I mentioned earlier. Kanto, the province in the north, is also in the Golden Triangle. If some of you have an idea what the Golden Triangle is, it's where the drug trafficking is very, very big in that region up there. The epidemic in Kanto is much older than the one in Dien Bien. The HIV program has been in place longer as well, and it has received significant support from international donors and partners up in the north. And Dien Bien is very new, or the epidemic in Dien Bien is very new and is still developing. And as I said, it's very mountainous up there, so it's very difficult for people who have the virus to actually access treatment and facilities, because it takes a long time to get there, and public transport is basically non-existent up there. So just due to the geographical location, it's very difficult for those people in the north to actually get early treatment, which they need. And Kanto in the south, as I said earlier, that's surrounded by water. It's an older epidemic, and it's an even split between urban and rural areas. So in terms of access, it's much easier to get and reach those people that have been affected. The treatment 2.0 pilot was actually was implemented in 2011. It's still going on. So the assessment was done in July, August 2011 as of last year. The planning then started in September all the way through to December. So I was part of the planning stage since I was there in October, November. So I'll talk about more later. Then the implementation phase was conducted this year in February and goes all the way through November this year. And then there will be an evaluation from November, December next year. So it's roughly a 2-year project funded by international donors and very much supported and conducted by the World Health Organization in conjunction with the UNAIDS. It's a UN body that is looking after HIV, AIDS, and hepatitis C. All right, so looking at the planning stage, who was involved in that program? Well, the stakeholders included WHO, NGOs, like non-government organizations, people living with HIV/AIDS and their networks, with the key population of higher risk, such as like female sex workers, men having sex with men, and injecting drug users, as well as health professionals, obviously, and the district and the province health centers, local authorities. The problem with Vietnam is Vietnam is not considered to be a developing country. Vietnam is considered to be a middle-income country now. So that problem lies in there that Vietnam has recognized the problem. However, they haven't been using the funds that they've been given resourcefully. So now the international donors are very much involved in trying to maximize and utilize the funds that have been given to Vietnam in an adequate manner. So what they tend to do is to just throw out money and implement programs, but without actually noticing that there is actually a time limit because of the status. So what it means now is to prevent and control HIV/AIDS in the long term. Vietnam must focus its efforts on mobilizing greater and more diverse resources and using those resources effectively, basically, because money will run out at some stage. That's for sure. And when I was there, they had a big, high-level meeting where representatives of the Global Fund actually talked to Vietnamese government, saying that money will run out in 2 years. That means that Vietnam has to step up now and use their resources and integrate the program that was initially initiated by the WHO into their primary health service system. So that's why Treatment 2.0 was actually seen as an opportunity to take on that momentum and lead and be the leader and take ownership of that, and use that as an appropriate platform to gather stakeholders to support that initiative and make evidence-based decisions on how to respond, especially in those 2 pilot provinces. Obviously, Vietnam has 64 provinces, so you cannot roll out that type of program in all 64. So that's why only 2 provinces in 2 different geographical areas have been chosen. In order to reach those people living with HIV/AIDS, obviously it's very crucial and critical to get them involved. So as we know, is that there's a low uptake on services amongst people living with HIV/AIDS. There has been some successes in the past in order to increase the number of the key population to have them tested and to actually allow them to utilize the resources, the health resources that they need. But because they are so marginalized, and their greatest fear is fear of stigma and the fear of other people getting to know their HIV status. Vietnam is, again, one of those countries where if you are a drug user, if you are known to have HIV, they actually put you in centers. Because it's a criminal act. So it's a very fine line between human rights issues and trying to tackle the epidemic and to contain that epidemic. As I said earlier, it's a concentrated epidemic, but all those people affected, out of those 200,000, they have lives. They've got wives and partners and people that they spend time with. Who then could also potentially be affected, and so on. So it's a concentrated epidemic, but the risk is that it's going to spread sooner rather than later if that's not contained. So that's why it's so important to get these people tested, especially if they are part of that key risk population. Obviously, the greatest fears, as I said, is stigma and discrimination, as well as trying to protect their confidentiality, obviously, and to make sure that if they have been tested positive, that that status remains confidential. All right, so WHO and UNAIDS have been involved in that project very much. the WHO and UNAIDS have two different, like WHO is more like, has got the technical expertise, and I can definitely say that having worked in that office, I must say that I've come across amazing people with a lot of knowledge and years and years of experience working in that field, and they travel a lot. Every week they will be away on attending international conferences and meetings and so on. So the WHO is definitely a big tank when it comes to particular health-related issues, like in that instance HIV/AIDS, but they're working in a lot of other areas too. So they've got the technical expertise and focus on adaptation and implementation of evidence-based technical guidance for a simplified and more efficient treatment. The UNAIDS, on the other hand, they are more involved in community mobilization, HIV prevention, stigma and discrimination elimination, and cost reduction. So they would sort of continue the work that the WHO does in a different way. So they actually get the community involved and try to engage the key stakeholders in order to increase the numbers of people tested. And that's where my role was. My role was to research and look at ways of trying to come up with a workshop or with educational material to encourage people in the provinces to get tested, which then I very much liaised with UNAIDS. So we had regular meetings to share that information and to actually put a practical plan in place. So that's definitely happening, that the exchange of information between those two bodies is very much utilized.
So previously was there any kind of tension?
WHO hasn't got money as such, so they cannot be a donor to a country, so they're actually getting money and funds from various other sources, such as Global Fund, Bill Gates Foundation, very much. UNAIDS is a UN body, obviously they've got their own agenda. So if you have 2, 3, 4 or more bodies or organizations wanting to take a similar problem, you always have politics that play a big part. And I can say that politics does play a part, as it is everywhere. Because they've got their own agenda, they've got their own objectives, obviously. So the key is then to get together and compromise and have regular meetings. I think that's the most important thing, and invite them to meetings that are of importance and vice versa. So that exchange of information and evidence-based practice is definitely happening. However, as I said, like any other organizations, they do have their own agendas, and it's important to sort of come to a consensus. On top of those two bodies, you also have like non-government organizations that definitely want to have a say in that as well. So it's a bit of a balance act to get everyone.
You speak in generalities. I mean, can you give a specific example of what sort of problem you would have, and you might overcome it, like an actual case study, a problematic situation where you've got conflicting interests and probably delivering to the source. I mean, the whole lot used to get to the source with funding, right? But people want to take ownership of it and make it their own little project, or what's the nature of things? And being done, is they sort of communistic in their approach to things, dictatorial about how things should happen? Liberal and democratic.
Yeah. Look, Vietnam is very much still a socialistic country. As I mentioned earlier, people that actually inject drugs or considered drug users, they have to be very careful, because the police can come and actually take them away and put them into what they call rehabilitation centers or centers of sick and women who are actually engaged in I'm not going to say but in that type of business, they have to fear that they've been deported as well. They can be deported to O5 centres. Okay, so the government has definitely a close eye on those people that misbehave in one or the other way, right? So that's where the conflict comes in, where the UN bodies and the WHO has made a commitment to tackle the problem from a health point of view, to try to reach those communities and to get them tested sooner rather than later. Then you've got the government and the police, prosecuting them and trying to take them away to put them into detention centres, literally. So you've got a lot of national bodies and agencies that are actually trying to have a say in that, and by that I mean that it's a very delicate process.
Well, they ameliorate criminality, don't they?
That's right. They're pretty much saying they're criminals, and the WHO and the international community is saying that they're individuals that need to be able to have access.
People don't want to volunteer themselves because they've been watched.
That's right. That's right. And for them to access treatment or to actually have them tested, it's all voluntarily. So you can't force someone to just go to the primary healthcare centre and have them tested, because once they do that, they have to fear, once they've been tested and it comes out that they're actually positive, that means that then everyone knows, and that could be reported to the police. So Vietnam, I mean, as much as it is, as much progress as has been done, there's a lot to learn as well, because as long as this is a criminal act, people cannot be helped entirely. So and then you have that's the biggest problem. You mentioned that
you are legal challenge.
Yeah, definitely.
No, I mean, are they trying to change the legislation?
You said trying, yes, they're trying. However, reality is a little bit different, because we are talking about Vietnam and not any other country in that region.
Can I ask a question? How did you get onto language?
Well, look, in the office, they all speak English, obviously. Having talked to those key stakeholder populations, such as people living with HIV, they can speak English. Sometimes it's broken. You have to speak slowly and with pictures, we have brochures. But as I said, because the majority of staff in the office were actually Vietnamese, so they speak English obviously very well, so we use them as translators.
A lot of them speak French as well, don't they?
Not a lot, but yeah, some. Yeah, you're right, Hanoi has got a very nice French quarter. But we utilised the staff that we had, working from this background.
Were you expected to speak English?
No. I mean, the UN language is English and French obviously as well, but French wasn't spoken. It's English.
So when you got results that were positive, shouldn't that have been kept, private? Is it necessary that the police knew about that?
That's right. I mean, on one hand, it has to be kept private. On the other hand, once you have been identified as someone who has the virus, you need to have the treatment. So you don't have the treatment unless they know that you're positive. I mean, so that's a catch-22, and that's a problem. That's why I also had meetings with an organisation that was an NGO that was actually working in those detention centres, and used the people in there as peer educators, because I'm going to be talking more about peer education. But they actually worked right in the centre where people that have been identified as positive actually were sort of locked up, basically. So it's catch-22. On one hand, they need to know whether you're positive or negative in order for you to have that treatment, antiretroviral treatment. So that's why it makes things really, really difficult.
There's no actual cure at this stage, is there?
Not a cure.
But there was a case of a fellow who did cure himself, and I think the doctors are examining him very closely.
Okay.
But that's very rare. So
AIDS cannot be cured. What can be done is through the ART treatment, your symptoms can be contained basically, and so that you live longer, that your immune system lasts longer basically to fight all those viruses that as humans are exposed to. So it cannot be cured, but with an evidence-based practice, that ART treatment, which is very common in Western countries, is actually a good way of trying to contain that. However, it's very expensive. As I said earlier, it's expensive in an initial stage, but then over 5 or 10 years period, once someone has been assigned to that part of the treatment, is actually very cost effective.
What was the treatment again?
ART, antiretroviral treatment.
Is it difficult to get the people to stay on programs? Do you need a fair bit of education?
That's right, and that's exactly right. And you mentioned the language barrier, and that's definitely one of those barriers, is that people in those two provinces, you're talking about people that probably never left that area because they literally can't, and they probably don't even speak English. So, and you know, their fathers, mothers, sons, they have to do a job, right? They work in the farm, they work as fishermen, whatever they do, they have to really dedicate time to go and have the treatment, which is sometimes not possible because it interrupts their daily activities of, you know, being the breadwinner, for example. So
this is where the whole aspect of attitudes and values comes in, isn't it?
Correct.
Their difficulties in trying to work out where they are in their own location.
Correct.
And then kind of have a way of working out where they are in the world, as
That's
well
right.
as just in the local area.
That's right.
Yeah.
That's right.
Have you got to pay the police off for keeping away, this sort of stuff?
Now that's also called corruption. It's very very much helping.
You've got to toss them something, keep them away?
Look, that's what they have been telling me. That's definitely happening.
So where would $1,000 go? If you've got $1,000, where does that go?
I have no idea, but I do know that there's always a window of opportunity, let's call it this way. Unfortunately, but yes.
But if you have $1,000, what would you put into to make it work? You just augment the supply of drugs already? Or
Definitely. Another problem is, for example, if rapid testing. All right. I actually have been in contact with these people at the office. What they've actually done is with $2,500, they've got those rapid testing machines, which you wouldn't be able to hear them because in Australia and other Western countries that's standard. That you go to a clinic and you get your results within like a couple of hours because it's this tiny little device that spits out the results in a short period of time. While in Vietnam and other countries, you go and have you tested today, and you will have to wait weeks and weeks and weeks to get the results. Yeah. So people have to travel quite far to just get tested, and then they don't even know whether they're going to be positive or negative. Then they go back and have to come back. So that journey is very much another reason why people don't do that. So now they've got those rapid testing systems, which is a tiny little device that you can actually carry. And that would help now to have them tested on the spot.
So they come in two places, couldn't they? They don't have to come to you, you can take it to them.
Correct.
How many of those do you need? How many do you need? 100? 200?
Possibly.
And how much do they cost each?
$2,500.
Okay, so one of those would be added.
Yeah.
Would augment the program.
Yeah. As I said, it's getting people tested in the first place is the greatest barrier because, as you say, you have to shift an attitude. You know, they face stigmatism, they face all sorts of barriers. In the family actually, some families, they just expel them. They don't want to have anything to do with this person that attracted the virus. Obviously because they're shame to my family, shame to my community. So you're talking about like a shift in attitude and belief system to a great extent.
You can't change that overnight.
That's correct. That's correct.
It's not part of the communistic philosophy, is it? It's just a general American Asian thing.
Yes, yeah. Yeah, you brought shame to our family.
Yes, which is common throughout Asia.
Yeah.
May I ask if perhaps more in the South, I really wonder, with the Catholic influence during the French times, I don't know how much that has continued or grown or lessened, but there you would have a different question arising too, wouldn't you?
Definitely. Definitely, I mean, you know.
With the use or non-use of
yes.
And all the whatnot. So,
yes.
So that would be another problem entirely.
Definitely, definitely. So, you know, you can look at it from every angle. It's just something that's really difficult to tackle because it's such a big problem, because it affects the individual in the first place, it affects their next of kin, it affects their partners, their kids, their family, their immediate family, and then the community. So it's a problem that affects basically everyone. And you may want to say close to 200,000 people is not a lot, which is probably not a lot in the context of Vietnam, but it's big enough to cause problems in the long term if you don't contain it. And that's what, as I said, that's what they're trying to do, is to have them tested sooner rather than later, before they can spread.
Is it homosexuality, or is it women, the hospitality women that get it? What's the cause? Do they know? Is it the hangover from the Americans in the Vietnam War? Is it perpetuated there?
Possibly, but as I said, the main out of those three groups that I mentioned earlier, the injecting drug users are the greatest, and especially people in the north, you know, the Golden Triangle, Thailand, Vietnam,
So it's drug
Cambodia.
addicts that
Yeah.
passing on.
Yeah.
How do they compare in comparison to Australia?
In terms of what?
Oh, just the numbers, the drug users, the numbers.
I don't know, I don't know the exact numbers, but I probably would be able to guess that the number is quite high over there. Because you've got poverty as well. I mean, or, you know, people will take opportunities everywhere they can, and if you live in that area, it's probably cheaper to smuggle the drugs than making a living by, you know, by going into a farm or, you know, sell things in the shop. I mean, Dr. Tammy probably would be able to
Yes, I understand. According to my information, it's not about 160,000, but it's about 800,000 people contracted HIV.
In Vietnam?
Yeah, in Vietnam, the official record is different from the unofficial.
What's the population?
What's the population?
The population in Vietnam, 80 million now. We have, at the present time, there are about 80 million people in Vietnam, but there are about 15 million contracted hepatitis B. Yeah, it's comparative to the number we have HIV is too small. 15 million.
Out of 80.
Yes. And we are providing the free vaccine for the every year is about 120,000 children to prevent the hepatitis. Yeah, hepatitis B.
So is that being stigmatised as well as HIV? Is that being as well?
You can probably get hepatitis from the water, can't you?
Yes, you can.
Is that as bad as being HIV over there?
Hepatitis C is a complication that arises from injecting drugs, sharing needles, you know, and
Is that the same stigma as having HIV?
so hepatitis C, I'm not quite sure about hepatitis B, Dr. Tan, but hepatitis C is definitely also big on the agenda. And there's another task force within the WHO that actually tackles hepatitis C separately, in conjunction obviously in the program, but because it's now a growing problem, hepatitis C in conjunction with...
But please look up Hep C as well as the HIV.
Sorry?
You look up the Hep C as well. They're both treated the same. Because it's usually got both, haven't they? Often.
You can say that everyone, or a lot of people that contracted the virus actually have also got hepatitis C as a complication, as a consequence from, for example, sharing the needles. And that's very common in Australia too, hepatitis C. Not to that extent obviously, but it's because of the complications that arise from using drugs, and in particular sharing needles and you know, unhygienic circumstances that they expose themselves to.
What is the growth in tourism now, which is the situation even more now?
From what I can tell is I find Vietnam a very fascinating country. I'm definitely going to go back because obviously I haven't been given the opportunity to travel as much as I wanted to. because my main purpose of going there was to be part of the project. So I will definitely go back. And having also been in Thailand, I can say that Vietnam in the next 5 to 10 years is probably going to be taking over, simply because it's a beautiful country, the people are very friendly, it's cheap, I guess, that way, and it has got lots to offer. Vietnam, yeah. So I would not be surprised that from a tourism point of view, that Vietnam is getting, if not bigger, but at least is attractive in a tourist destination to Australians and around the world.
How many people went to Australia?
Oh, I met a few Australians.
No, in your project.
None.
Really?
We had Brazilians, Japanese, Americans.
But your project is concentrate on the Indian city, which is a remote area, and the maybe I can say the very close to the border.
Yeah.
There's something isolated area. It's not in the city. The city population of diseases people is too high. The people in Hai Phong city, Hanoi city, Ho Chi Minh city, or in central or the Vietnam where cities, the rate is very high. In Ho Chi Minh city alone, it's about 500,000 people contracted the HIV.
I was thinking in terms of the cruise ships that are just coming like this all the time. And last year was on one of those 2 separate days in Vietnam and some other Southeast Asian countries. But the same thing could be happening on those because there are all these people coming in, and just for a day or two. And one does hear conversations occasionally at dinner and whatnot. So, there's no way to keep a tab.
That'd be pretty quick just to be there for a day or two, wouldn't it?
Yeah. And that's what I meant by. Sorry.
You're a man. How long does it take?
I'll stay on the cruise boat, I think. Oh, there you go, yes.
No, I mean, it's becoming, it's so easy now to have access to these people who have not been contaminated in some way. Sorry about that.
Excuse us, wait a minute to shut the cameras, please.
Yep.
Camera's got a dead battery, another one's going on cancel.
Thank you, Jeff.
Thank you
The great club of King's Cross. Okay. I think those transport things should be one of those.
Okay.
What do you want with your camera?
Well, they're not mine. There's-
One is mine.
One's dead, the other one's good. Sorry for getting it. Wonderful. Thank you very much. Thanks for that.
See you. Have a good night.
Thank you, Vice President.
Yes, Pamela, you're right, and that's why we, we have to try to contain that and educate. It's more about education actually now, to because that topic has been put or what has been discussed enough. People are sometimes not even aware of the basic understanding of what HIV is. So education and peer education in particular is very important to try to contain that number. If you want to relate it to tourism. And as I said, people in the country, they may not have the knowledge or be able to actually read and write to comprehensively understand that significance.
How do you get access to the sex workers? Is it similar to Thailand, where they bring them from the country and then they're sort of kept like slaves? Is it the same in Vietnam? Can you get access to them to educate them?
No, it's just impossible because as far as I've been in Vietnam for many years for charitable activity, the sex worker from the village or from the countries, and they just spread over the different residential area. That's a practice for them, for the career. Whatever, it's very difficult to identify who is whom.
Yeah.
It's very difficult.
What about things like tourism and going into a restaurant and going into the washroom? For example, when I was in Italy, compared with Australia at some point, I just felt ill when I went into a restaurant and you had to go to a washroom, to use an American expression. I just felt really ill. And, there is this awful chance that you pick something up. How does that, what I've just said, how does that relate to say you go with some friends and you want to go to a restaurant? How do you feel? You have to wash your hands.
Yeah. As I said, look, Hanoi, I can make reference to Hanoi, and it's a very clean city. I have nothing negative to say about that. Obviously, it depends where you're going.
You can also be brainwashed into thinking.
HIV no, that's where education comes in. You can't pick up HIV just by going to an unhygienic bathroom, so that's simply not possible. As I said, it is related to whether you're injecting drugs with a needle or you share bodily fluids.
The virus dies actually quite quickly, doesn't it? Outside the body it dies quite quickly, doesn't it?
Yes, that's right. So just by going to a city that probably hasn't got the standards that you're used to, doesn't mean that you get the virus. And that's actually a very important point, because lots of people think that's the case, and we have to educate them, and we have to spread the message that this is simply not going to happen. And
sometimes I get trying to go on the train, from Central to Epping. I don't want to go. I have to use the washroom. I have 5 minutes. It's horrific.
Yeah, no, not gonna.
That just goes through your mind generally when you're traveling.
No, that's definitely a good thought. Just jumping the queue here, the model that I put together for this 3-day workshop, where the aim was to actually educate us, peer educators, had 8 modules, and the first one was actually the basics of HIV/AIDS and reproductive health. So during that, they actually learned what is HIV/AIDS and how can you get it and what can you do. And the second one was HIV/AIDS counseling and testing. That means that they should, as I mentioned earlier, should get tested fairly soon. And how can you test that? The rapid machines that I mentioned. The third one was communication counseling. It's very important for them to know that who they can communicate with and how they can communicate and have access counseling services. Next one was what is ART treatment, the antiretroviral treatment I mentioned, because once someone gets approved to have that treatment, they need to know what it's all about. It's very complex, very long term. It takes a lot of commitment. They have to take a lot of medication, so they have to learn everything about that. The next thing is prevention of mother-to-child transmission. That's actually possible. If a female has got the virus, they can actually infect their unborn baby. So it's very important to have a session around that topic as well, because there are lots of females that have been affected by that. And then obviously a topic on injecting drug users. How come that you can actually get the virus? What do you have to do? What has to happen in order for you to get the virus? Men having sex with men, again, just by being with someone doesn't necessarily mean you get the virus. You actually have to do something. Same with female sex workers. So basically, that peer education manual is trying to educate those peer educators so that they can spread the message, the right message, and not the wrong message. Which could be that everyone goes to a dirty toilet, it's going to get HIV/AIDS, which is simply not true. Oh yeah, that's right.
You just don't automatically think,
That's right. So obviously you want to.
That's where everybody feels like.
And I said the train is coming from Central to Epping,
I have a question. Are these people actually literate? Can they read and write?
Most of them are in the main cities, but
but outside where you have the problem.
Yeah, and that means that you have to.
Even their own language, because I'm quite aware that a lot of people around the world, they can't read and write their own languages. Now you try to educate them and inform them, etc. How do you do that?
And that's when the peer educators come in. The peer educators are people that have got the virus. So what they can do is they can spread the word in terms of like trying to make sure that that their peers are going to do the right thing in their own language, and that's why peer education is so important. Because peer education is something that you do from one person to another, right? So you write a group of people like us today, and the peer educator would be talking about that particular topic in their own language and convey the message, the right message.
Would there be a solution to that problem at the same time to tackle the basic education to people so they can grow into sort of environment where they can be informed and read for them and understand for themselves what it's all about? They need always somebody to, how do you educate a child? Girl,
No, I think
9, 10
sometimes
years
those
old.
Pictures.
Well, but in the long run, well, I'm going to live with the pictures for the rest of my life.
No, but I think what you mentioned a global problem, which is
global
interesting.
problem. Yeah, it's
Very
everywhere.
global. And obviously, if we could, literacy would be fantastic. However, there are people in this world, in various countries, in various regions, that unfortunately can't read and write. So, I hope that at one stage that problem has been eliminated. But unfortunately, until then, as you said, I've seen brochures written in that particular language, lots of pictures. People learn differently. Some are visualists, they need something in front of them. Some just pick up a book and read and get the knowledge and the message from there. So people learn and develop in a different way. So using pictures and visual material.
I know, I understand that to solve it immediately, but say on the long run, for the next generation at least, you should start to educate them now. With literacy, numeracy, and get them basic hygiene and basic human needs before you can solve HIV problem.
That's a very good point. And,
thank you.
Thanks for that. But it's definitely it has some relevance to educating people on various health issues.
How is the growth of IT going down? Like in the cities, of course, you'd have television access or mobiles and things like this where you can use educational into that. But out in the remote area.
You'll be surprised. I will never forget that. Just outside of Hanoi, I went around in this very ancient, very old village, and as I got deeper into the village, we did some rock climbing there, and on the way to the rock where we set up our equipment and stuff, there was this house, and this house had the biggest Sony flat screen TV that I've ever seen. I actually took a picture because I was in the middle of nowhere, far away from all the tourists, and like in a tiny little village, and all I could see was like this big flat screen TV, Sony TV. So Dr. Ted, correct me if I'm wrong, but I think television or
it's very popular in
very
Vietnam,
popular.
and the purpose of having the TV is not watching television, but watching the CD or DVD recording. They have a CD or DVD, they just throw it in and watch it overnight, overnight.
So then videos would be a good way of educating them.
Yeah. And there's some NGOs actually been, I met a few people from around the world that work for various NGOs, and one was actually an NGO that specialized in trying to convey that important message through the media, and they used even like text messages and Twitter and Facebook and all those sources now relevant into trying to sort of get everyone engaged, especially the younger population that is so very savvy, technical savvy. So that's definitely on the agenda, and various NGOs are already working on that and with particular networks.
But I believe that any person can help him or herself if you stir up the knowledge and resources they already have within themselves by actually understanding the letters and numbers and know how to put them together and how to voice them out, read for themselves.
Yeah.
I believe that this is a spiritual development.
Yeah.
Not only that you can go and feed somebody, but you have to also show them how to learn how to grow their own food on a physical level. But this is literacy, numeracy, is very much close to the soul and spirit of our humanity. And we deny to so many people that very basic education. What's wrong with us?
Yeah.
What's wrong with the world? If we talk about Bill Gates, we talk about they don't know what to do with the money. And now we know the planet, we know almost every corner of the planet, yet we don't supply them with the basic needs. We still exploit them wherever possible.
Yeah.
And unless we stop doing that, exploiting them and supporting them where they need, the world is not going to brilliant heaven and paradise.
Actually, just on the tail of what Victoria was saying, do you actually search, she mentioned Bill Gates, do you search for sponsors to help supply the equipment and things like that?
Yeah, the WHO and UNAIDS for that matter, they do have to write tenders to various organizations such as the Global Fund, such as Bill Gates Foundation, such as some UN bodies have their own funds. So yes, that's for sure. However, what I can say is that funds will run out, definitely. And in fact, the Global Fund just recently announced that they're going to cut down on millions and millions of dollars. A, because they're not going to get the money, because first, like international aid and development, I mean, we had the financial crisis. So what was the area that was sort of cut down on was obviously international aid and development, even like Australia, as much as they're committed to our part of the region in Africa, they have cut down. In fact, they have increased it to 0.7% of the GDP. So that's just the beginning. In another 5 years' time, funds will definitely run out. But then the problem is then, what are the countries doing, such as Vietnam, to actually ensure that whatever it is that they receive the money for, in that instance, the pilot program, how can they integrate it into their health system to make it more viable? Because so far they've just been like getting the money constantly, and you have those international organizations working with them, but eventually that will run out. So it's right now they actually they need to communicate that to the Ministry of Health and the Vietnamese government that this is going to happen, and it's soon up to them to keep their project running. And any other country in this world that relies on international donors has to accept that problem now, that they have to efficiently use those resources that they've been given, because they will run out and they will be drastically minimized because the money is not there anymore. In fact, people asking why does AIDS have their own United Nations body? We've got so many other diseases in the world that needs to be tackled, but the UN have their own AIDS and hepatitis C department. So that's definitely also on the agenda. I mean, they're trying to sort of cut down wherever they can. And, why not? I mean, why do you need your own UN body just to tackle one particular issue if you do have like a million other issues that you want to tackle, but you don't actually have your own government body or your United Nations body for that? We earlier heard
every country.
I read some very story about the AIDS issue related to genetically modified food. There's something else that's suspicious about it.
Oh yeah.
You're saying that.
Yeah. I guess there's a lot that we will hear. Yeah, there's a lot that we will probably hear in the future. But look, coming back to peer education and the importance of educating your peers that are in a similar situation, one advantage is actually empowerment. You mentioned earlier that we should educate others, and I guess in doing that and using those people, it actually empowers them, because then they're very important and they feel that they contribute to society, to the community. So that's definitely a way to go and to move forward, and that's why the project emphasizes so much on peer education, because who's going to listen to someone like superior? That normally doesn't happen. You listen to people that are from your own tribe or from your own community that possibly have gone through the same. So obviously these voices are being heard much better than others that are unreachable. So
I suppose in that context they feel they're making a contribution. And,
that's right.
They can find their place in the whole of what's going on.
Even if your funding dries up, if you've still got peer educators in place, at least that's something that's there.
That's right.
That's right.
If you don't do that, then funding runs out, so where are those people left? Worse than before.
The whole thing with all that, relying on funding all the time becomes a focus.
No,
Is
I,
there funding then the project dries up?
It's definitely on everyone's mind.
Yeah.
Where do you get the money from? And
And that drives the project.
This is the very essence of what we are listening and doing here, isn't it, at the moment in this session, these sessions, because I've only been to two, is that the self and the difference you can make there. And even if it's, we have to work at both levels, at the top there and there and all that. But it's so important that the little differences we can all make. And when we speak to people, or small donation, or as you say, like teaching or giving packets of seeds, or doing things like this, so that there isn't that need for so many women to have to sell their bodies as such to get some potato, which is spreading again. But so I feel it's very much with the women who need to be working, and as you say, empowering them. But it only takes a little amount, just a small amount, to give them that independence or to get them going. You know, in so many NGOs about you might buy a sewing machine for an individual, you might do this, you might do that. They're little amounts, but they can empower and they can change it in the village. And if the wife's working and the children, I'm also leaving it to the man, as you say, but yes, there's a place for working, for all of us to be working in our own way, and not relying so much on big handouts, because we're, you know, the Bill Gates and all these that can do it, but we can't do that. We haven't got the money. You look at the AGM today and the financial report. But in our own ways, we can make a difference or spread the word or try.
If we want to contribute some money, and what we do.
Look, the problem that we had initially was still the problem there is to get those rapid testing machines. What I will do is I will make inquiries and I will get back to you then, because obviously it will definitely help. Because if a community has got that machine, it will enable people to get the results very quickly and to actually encourage them to have the test in the first place. So that's definitely something I can think of. But I will come back to you on that, Judy, because as I said, today I'm here to sort of just share that information with you and to encourage you to participate in that discussion, because it's just one example of what we can do if we just step out of the comfort zone for a moment. So I'm not sort of, right now I'm not here to sort of, collect money. I'm just here to sort of, I guess, initiate a conversation and a discussion. But I know that there's definitely room for that when it comes to providing them with the necessary medical equipment that they need in order to get that done very quickly. Yeah.
Just following up on Pamela's point too, how are women, how are they situated in the program at the moment?
Look, in Hanoi there's a museum only dedicated to women. I don't know whether you think they're not, but women have struggled significantly.
Excuse me, I have to go to train. Thank you.
And they're still work very, very hard to make a living and to provide whatever it takes to raise their kids and to care for their husbands. I mean, it's very heartbreaking to go through this museum and see what women have, the extent of what they've suffered over the last few years.
Sorry, what was the
women in general, yeah. For example,
where's the museum?
In Hanoi.
Yeah.
Especially after the war, the men may not have come back from the war, they may or may not have been injured in that war, so it was really up to them to raise the children, to feed the family.
You said the women's museum?
Yeah, it's a fascinating museum, and it really honors women of Vietnam in every area and every corner of the country. You've got lots of customs that, again, Dr. Tam, correct me if I'm wrong, the ideal family is husband, wife, and children, but what if the marriage doesn't work out? Okay, so you have to divorce your husband, and then divorced women are not seen as women that deserve the respect as married women.
Culture.
Culturally, you're facing a lot of issues there, and the struggle to make ends meet is just very difficult. You will see women from the country going to Hanoi for weeks and weeks, trying to sell their goods on the street, and then go back to their village and take again care of their family or their children. Road traffic accidents are very common. Lots of people lose their lives and their limbs and extremities and everything else. So you've got lots of males and females getting injured to the extent that they really suffer badly. And the other person, road traffic accidents, like on the road, like cyclists, motor scooters. Scooters are a very common form of transport. A lot of people actually have scooters, like little motorbikes. And I was there for a couple of weeks, but every day there was an accident.
Where did you stay?
In Hanoi, in a hotel, but I had to walk 15 minutes from the hotel to the WHO office, and at least once or twice a week you would see accidents, and horrific accidents, because there's no helmet. To wear helmets not. Well, it's compulsory now, but you can get the helmets for $2, and they're just a better plastic cap, right? So no standardization, and it's really bad. So, and as you can see on the photograph here, I actually put a photo in here of the young child in the transport, where the child, you see the child squeezed in the front, you've got some in the back, and sometimes you actually see whole families moving around on the scooter.
That's very common.
Yeah, and I actually talked to colleagues in the WHO office that are purely looking at road safety and trying to minimize. Some people move furnitures and houses on scooters. It's unbelievable.
On YouTube, different villages.
Yes.
Sometimes you have 5 or 6.
In India, I've seen and 4
Yes.
on a little motorbike. Both parents and 2 kids, maybe the dog as well.
Yeah, everything that you can imagine.
A few chickens as well. I have one question. What about landmine injuries and accidents that are still happening in
they probably do.
Silent way? They don't want to talk about that because it doesn't look good.
Probably do.
Still.
Oh, a lot.
How much of the whole thing is still with repercussions?
Look, it just isn't that. That's right. The war.
Nobody's mentioned it.
This is incredible.
It's like Vietnam, the wars on there, like in the background, and now Vietnam's over.
That's right. Everything is fine. Okay, everything finished.
We
have won.
But is this sound repercussions or all those toxic chemicals?
When you were speaking about traffic, I was in several weeks in Southeast Asian countries in 1972. Going back to 1972. And Thailand, Bangkok, and we had the world's worst for traffic accidents in 1972. And I was in an accident, in that too. And that was 72. So every one of those countries now could probably be ranked among the most traffic accidents.
Yeah.
I lived in China for 5 months, about 12 years ago. So I certainly know about the bicycles and the motorbicycles and how much one can carry on whole families. But I don't think the accidents were quite so bad, they were those. But certainly I know Bangkok all those years ago had the honour of having that.
Marvelous images in magazines of people in Vietnam crossing in a forest, they don't have a bridge. They have 2 planks, and they're carrying their babies on their back.
Yeah.
Their back. You know, as they walk, I don't know, not like magazine, but you know, famous photographs where they are at dusk going to work on late lift, you know, going on across a delta or something. It's like carrying their children or carrying their implements with which they're going to work that day.
Yeah, that's right. And I'm just amazed by if you think things are impossible, forget about it. You know, think again, because they are possible.
If you think things are impossible.
Well, what you think is impossible, but you know, people convince you otherwise, and that's when you see, you know, whole families, for example, moving houses on the scooter, or they fit whatever they can fit on that, you know, the 2 wheels. So, or crossing rivers, or you know, riverbanks in a way where you probably thought they would never been able to. So, and that's the beauty of doing that type of work, because you get to see different cultures and you experiences that are definitely mind-blowing.
But you also sort of feel in comparison with your culture and our bourgeoisie attitude that we go and have a coffee here or a coffee there or tea there, you know, get your hair cut over there, fly up here, you know. And also, I get like that, and I just think what courage they have to do those things. And it's my own bourgeoisie, you know, Australian, British, you know, as I say, you know, we get a coffee here, but you don't get your coffee. My coffee wasn't right. Then you say to your friend, your coffee wasn't right. That's your level of your day. The train was late, you know. I mean, that's the level of your.
That's right. Everyone thinks that are so insignificant.
Then you see the courage they have.
Yeah, that's right.
To live their daily lives.
And if most Australians went there to see that, they would never complain about the bicycles in Sydney, because they complain about handful bicycles.
But then again, if you're born into a culture and that's what you know, then that's what you know. You know, you're very much what you're born into.
That's right.
You carry it.
That's right. And I mean, the reason why I mentioned road traffic accidents is because obviously things can happen, and I think the question was raised earlier: what do women do, and how do they cope? Life is very unpredictable, so things happen all the time, and that will be, you know, road traffic accidents, sickness, illness, death. Whatever it might be, unemployment, whatever it is that's there, that's troublesome. Women are always the stronger ones, I guess, trying to make money, trying to you know, raise their kids, and that's probably their main reason for living, is if they've lost their partner or care for their partner and have nothing else to do. What it means is to raise their children is so important to them, and they will do anything, from getting up at 2 o'clock in the morning to reach Hanoi by 5, to sell their goods by 10, and to go back again, and do that every day. That's what it takes, and that's what they do. So from the message that I got from walking out of this museum is that women, and in particular Vietnamese women, are probably one of the strongest people I've ever met, and it's just amazing what they are able to do if the duty calls, you know, to raise their children or whatever it is that they have to do. They will always find a way to reach their goal.
But not only the children, because the elderly parents are not so elderly because the life expectancy isn't so high. But that respect and that for the elderly and their parents. And I mean, sometimes that woman can be looking after 4, 5, 6 people and her husband's not there. So I mean, there's a terrific responsibility on my shoulders. So I mean, we need to say we should or shouldn't have done this for 10 years.
That's right. All right, I guess, as I said, in relation to peer education, obviously what you're trying to do is to change a behavior, which is what we heard earlier, is trying to change someone's attitude and behavior towards a particular topic. So basically what we're trying to do is to change a particular risk behavior amongst like a target group. So it means that the person's attitudes towards this behavior and the beliefs is about the consequences of the behavior. So what is it that you have to change? What is the consequence from arising from that change in attitude? And obviously what's also important is someone's subjective and normative opinion on what others think that they should or shouldn't be doing. Especially we talked earlier about small communities where you shouldn't be doing something which is then considered to be as risky or illegal, and someone's own opinion obviously has a great impact on committing something that others perceive to be a crime or risky behaviour. So you're trying to change someone's beliefs and attitudes and belief system as a whole, because what I think is right does not mean that other people think it's right too. So you always try to change that opposite behaviour. The concept of peer education, so the reason why we initially walked down the path of trying to educate those people affected through peer education is to change that behaviour, because we know that people are highly influenced by the perception of what their peers think. So as Albert Bandura, who's a psychologist, says, people learn indirectly by observing and modelling on others with whom the person identifies, and through training in skills that lead to confidence in being able to carry out their behaviour. So I guess that statement is quite right when we talk about peer education, trying to encourage someone to identify themselves with a particular behaviour and normative attitude in order to provide them the confidence that they need to make the change and to adopt to those changes. And because we were trying to implement a 3-day workshop to educate peer educators, is all about learning. So what we want them to do is to learn something new. And there's an ancient proverb that makes a really good reference to that. It says, tell me and I forget, show me and I remember, involve me and I understand. So that's why it was very important to engage them during those 3 days, and we also did that by running like role plays, because as you said earlier, sometimes the language barrier was there and they weren't able to do it right. So role play is a very good form of trying to convey a message and to integrate them and to actually engage them in that behavioural change and shift in attitude, because they can then step outside their comfort zone and forget about themselves for a minute to step into someone else's shoes and play the type of the correct behaviour. So you're trying to correct that bad behaviour with a good behaviour.
This is wonderful and really terrific job. At the end of the day, somehow at the same time, there should be a system where you empower a person himself to be able to function on their own accord and seek information by themselves, how to learn more, not what somebody else wants to show me, wants to do, but through material. And I want to know something, I want to ask you, but I want to know.
That's right.
Okay, that's where religions also make big mistakes, get people literate, and they read the Bible and I'll tell you what's in the Bible. Okay, or any other book, or I know about the Bible, okay, so, but when I learn how to read and write, then I read the Bible for myself, and it turns out to be different.
That's another thing. That's right.
So
that's right.
teach me how to read and write.
And you also need someone to interpret that message. I guess, whether it's in the Bible or, the HIV AIDS or whatever it is, you need someone to convey this message and to interpret this message in a right way. Obviously, then right can be wrong to another person. What is someone's belief model, right? So, but I think in essence, you need to have someone that you trust, that you open your ears to, that you want to listen to, and you want to take that message from that particular person. And in that context of peer education, obviously the peers are very well positioned to form part of that very important process. And because
I think what's been opened up here is one of the sort of internal paradoxes of any educational process. Maybe, I don't know, maybe it doesn't apply so much to this one, I don't know. But I think it's interesting in itself. Yes, at some point in my progress I need someone else to take me through it. But at some point in my progress I may actually finally turn around to someone else and say, well, actually, I now feel that I know more about it than you do, and I don't totally agree with all of the judgments or all of the interpretations that you've made. I have to make my own interpretations, and I have to stand by them.
That's right.
That's
That's
right.
right. That's right.
That's
But
pretty
I-
much what I was saying.
Yeah, that's right. But in that context, I do believe that the information that that's being shared around has to be correct when it comes to, you know, when I talked about like the modules, like there were 7, 8 modules that are very important when it comes to educating someone on their HIV/AIDS, on the disease, on how they can prevent it and how they can prevent mother to child and all those things. So educating someone on the facts are very important in order for them to then make their own decision of whether they want to convey the message or not. So, because obviously if the message is wrong, then the whole system or the whole concept of peer education may not be as effective as we thought it would be if they convey the wrong message.
Yes.
So the basis have to be right.
In
In particular, when it comes to the issue of HIV/AIDS and how to contain that disease, because the reason why it's spreading so quickly is because people don't know about that, and they have a completely wrong concept of how they can get that virus. So the facts have to be right in order for them to determine whether I share it or yeah. So that's why peer education is so important, and not only in the context of Vietnam, but also in the context of everything that we do as part of like living in a community. You know, we do listen to each other and we respect each other's opinions and beliefs. So it's up to us to use that and to make necessary changes if we think that our belief system needs some.
So far as important is to learn one language to be able to communicate, because it's still the basic tool of communication, face to face.
That's
one
right.
and the same language.
That's
Doesn't matter which
and
one.
that's the very basic.
That's very basic.
That's
It's
very
very
basic.
close to human soul still.
That's right.
May I make a complimentary comment on this issue? Where the people have been educated to understand the risks of the HIV. The second factor which plays a very significant role in the HIV is the poverty.
Yeah.
When they're too poor, they don't care. You know, they may die tomorrow. They're starving today, so they really don't care what risk this is they are doing. I'm the Vietnamese, so I know the culture and the poverty of the people. When they so poor, $20 a month for a lady who get the earning to feed the family 4 children, so they really don't care. You know, that is a problem. Even if you expose the high degree of risk to them, they just say, so what? Tomorrow I die. I'm starving today.
That's right. That's right.
So the important thing is the poverty. You see,
An English doctor said that somebody comes in depressed, and he says, "Why are you depressed?" He said, "Well, I don't have enough money to pay the rent next week." And another person comes in and he can't pay the mortgage on his house.
Yeah. And the important thing you just mentioned about religious, the factors in that HIV context, I believe that the religion plays a significant role. If I'm as a monk, Buddhist monk, which control about 80% or 70% of the Vietnamese population, when I say to Buddhist people, I say, come on, you go to hell, and they listen. They're scared. But if I say, don't do it, you get sick, you get disease, you die, so what? But if I say, come on, you do it, you go to hell, and they listen. So no misconduct of the sexual activity, because it is prohibited by religion. They go to hell and they listen.
Yeah,
so that you see the culture and the religion play a very important part.
But why do they?
Yeah, they stop.
Yeah,
but why do they expose
themselves?
themselves?
Is something which is actually worse than dying.
Yeah, worse than dying, because you die, You
Why
just
will they-
just
Why
die.
do they have to expose themselves to sexual activity? To earn money.
To earn money.
Exactly. This is the back to basic poverty, basic human needs.
Yeah.
What is the basic human needs? We talk about human rights. What's the basic human needs?
But we don't have the resources to complement it.
Oh,
So we just tell them, okay, don't do it.
I know.
If you do it, after you die, you go to hell. And they say,
Where is that?
is it? So
I'm
that's the
very
way
told
we
right
say to
now.
them. And they listen. They listen to all the Catholic leader, Buddhist leader, even the Muslim leader. Now they have a few percent of the Muslim people.
But perhaps that's an argument for coming at it from more than one direction. So that I think it is important to give them the facts, the real facts, noting that they think they already have the facts, and noting that they're wrong, and also to talk about sexual misconduct.
Yes.
Because it does have that dimension to it.
It's one of the Buddhist precepts. It's prohibited by the religious law. So you
So it's
see,
in many precepts, but
yeah.
what's happening?
but if they
all
do,
around
they
the
go to
world?
hell. So they're so scared. You see?
I don't think so.
Yeah, majority of them listen. They stop doing it.
If they are hungry, they'll do it again, even if they
Yes,
go
of
to
course.
hell. Even if they go to hell.
Yes, yes.
But we talk about education, and one would say for educating and getting women out of, in any country, every place. But just look here, we are having success in things, but how many people in the US are like, with smoking, the education on smoking, it's out in the faculty, the education on dieting, not overeating, and the health repercussions. I mean, we couldn't have better education and facts, and because in front of us all the time in every chemist shop, in every doctor we go into, and it is changing some things that smoking has to, the same with it's gambling or whatnot. There is education out there, and you know, if the person doesn't want to take note of it, I don't know what to do about that.
Well, this education starts when the damage is already done, then we consider it education. But the real all-around education, in my opinion, is a little bit different. If we have real education about our life in different levels, people will probably not take too much drugs or cigarettes or indulge in any excess things in life, be it the food or whatever. This is still all basic education about myself.
We all have to try, and we all have to make a difference in our own little ways, besides relying on the UN and the World Health, where there's the money's running out because countries, sovereign states, are not putting in the money to do it because they're getting bankrupt. So I mean, we can't really blame, you know, we can't keep shifting the blame and say, oh, the government fixed that, or they did this, or they provide beds, so do this. We all have to play our part.
To make a small contribution here, you know, this community, which then obviously, I think, as you mentioned earlier, try to make a difference in your own community, and then it will lead to a global change. So if you start small and you're spreading the word, then your actions say more than 1,000 words. So that's exactly right. You start small. You don't have to make a big change because small change will eventually lead to big change anyway.
And tell me, do you feel that? Did you, when you left there, did you feel in your heart that you had made a contribution? Did you feel
Yes.
that?
Yeah, I did. I felt I was really part of something exciting, something that has great value and will change a lot of lives as well. Even though, as I said, 6 weeks out of 2 years is not a lot. So I guess my contribution is probably not as much as as the people that are already working there. But I felt like I really utilized whatever I did in those 6 weeks. I put into practice and I developed something that will make a good contribution to the overall program. And obviously, if I thought that I could change the world within 6 weeks, I would do it. But what I was able to do is to give a small contribution to something bigger and even more exciting that in the long term will definitely change and save lives. That's for sure.
In a biblical when we say, well done, thou good and faithful servant.
That's right. That's right. So, and it was one of the best experiences I've ever had. And as I said, I really like Vietnam, and I will be back. And the networks that I've sort of built up and the people that I got to work with are exceptional. And it's definitely worthwhile to do things like that, and it definitely gives me encouragement to move on from here and to maybe take even greater steps. But it was a small step, and it will definitely pick up on that and do something else with that.
Did you see ripple effect? Is that a ripple effect? The people you met, the individuals, the organizations, the people in the organizations, it's coming and speaking to us. And we go and speak, or we show somebody else this. It's that ripple effect.
That's right.
Yeah, very good. Yeah. Well, look, Pamela, thanks for leading us through a stimulating dialogue today. It's been really good. Appreciate it.
Thanks for having me.
Yeah, so we covered a lot. I think we've sort of built out the topic and the theme, so that's gone really well. Now, just a couple of things to mention. Our next forum will be it'll be the last Saturday of September, and I'm working on a speaker that's taking a little bit of time. It's an academic from Melbourne. More on that down the track.